Hey, Luis. So I also prioritized isolating Knox from other patients and visitors in my response. I think that that is probably priority number one. We want to ensure that they themselves are safe as well as everyone else in the facility. So, attempting to isolate them as best as possible, I think, is going to um, mitigate the situation more so than I think almost anything else. That's definitely a priority. I also mentioned having security present immediately, which you also mentioned. However, I did not mention removing the backpack from the situation. Um, so while I do believe that that's an important step, I don't know if it would be feasible or immediately safe to do that, like right off the bat. Um, so with that, I had a couple of questions for you. So, what if Knox has a firearm or another weapon on their person, and removing the backpack from the situation triggers them to use violence? How would you pose your TAM team remove the backpack in a safe manner so as not to incite any more aggressive or violent behavior? And do you think it would be appropriate for hospital security to inspect Knox's bag or wait for law enforcement to do so when they arrive on the scene? And do you think that there should be security and law enforcement, or just security or just law enforcement when dealing with Knox? And again, in the situation of having to remove his bag, because that might be a very triggering thing that could exacerbate everything that's going on and make Knox more hostile, more aggressive. So how do you pose that be done in a safe manner?